speaker, I introduce Dr. Ritesh Mistry, who is a faculty member at the School of Public Health, University of Michigan at Ann Arbor. And he is a PI of this project who really conceptualized this project along with along with another PI, Dr. Mangesh Pednekar of our institute. Most unfortunately, Dr. Mangesh Pednekar is not able to be with us because right now he is speaking in another web conference somewhere in some other university. But very glad that Dr. Ritesh Mistry is initiating this particular symposium. It has been a wonderful achievement for Dr. Ritesh Mistry and Mangesh Pednekar to get this R01 project on this subject on which they worked so hard. So once again, I congratulate on this project, which is already ongoing, and we will be sharing, everybody will be sharing the results of the first wave of this particular project. And I invite Dr. Ritesh Mistry now to make his presentation. Dr. Ritesh Mistry, please. Dr. Rana Singh is the co-chair of this particular session. Dr. Rana Singh, you want to speak something?
No, sir. I think we have already spoken, and I think, please, it's time to go ahead.
Yes.
We have very
little time. So 15 minutes, I think we can, each speaker, if they can finish in 15 minutes, that would be helpful. Yeah.
Great.
Dr. Mistry, you can share your slides, please. We have given you the access.
Excellent.
Okay.
Great. Can people see the slides?
Yes.
Yes.
Excellent. Thank you so very much, Dr. Gupta, for that wonderful introduction. Yeah, giving us some background about this study that we've been involved in for several years now. Yes, I'm going to talk a little bit now about the study. We're going to give you some baseline results from our longitudinal study of adolescent tobacco use in India. I'm going to basically give two presentations. I'm going to talk about some of the baseline results and then talk about another study we're doing based on these data about the issue of density of tobacco retailers and tobacco use in adolescents. So I'm going to do two presentations today. So I'll be speaking probably for about 20-25 minutes, I would hope, or less. So I really appreciate you all making the time and allowing us to share our work with you. It's really an honor and a pleasure to be here. And I really appreciate the flexibility in timing to allow us to speak early in the morning for you and late at night for me. So I really appreciate that as well. Yeah, so let me get into this study here. I guess I wanted to acknowledge some of my colleagues here. Dr. Gupta mentioned this is a multiple PI project. I and Dr. Mangesh Pednekar are co-PIs of this project, and we co-lead this project. He really is responsible for a lot of the day-to-day on the ground data collection activities and making sure the data are really high quality and all those kinds of things. And his team has done a really wonderful job here making this complicated project come together and move on successfully. And also Dr. Gupta and Dr. McCarthy have been wonderful mentors for this project. Dr. McCarthy has been my mentor for many years and continues to be and guide my research in the area of tobacco control. He actually introduced me to this kind of work. So I'm grateful for his leadership and his mentorship. And as well, Dr. Gupta, he's really helped me, get a footing into doing work in South Asia. It's near and dear to me as a South Asian myself now living in India, the United States of America. And many other people are working on this project on a day-to-day basis, and I really thank them for all their efforts, and some of them you'll be hearing from today after me. So just a quick outline of what I'll be talking about. We're talking about tobacco use initiation during adolescence. I think that's a very important topic, of course. We want to reduce initiation as much as possible. Adolescent experimentation, initiation is a high predictor of adult regular habitual use of tobacco, and again tobacco is one of the highest killers in the world, and including in India. When we talk about tobacco use initiation in adolescents, I'm going to talk a little bit about a pilot study that we did years ago that helped us kind of conceptualize the current study that we're doing now. So as background information, I'll be sharing some results from that pilot study, and then giving you some results from our baseline wave 1 data of our longitudinal cohort that we've established in Mumbai and Kolkata. And then to do a little bit of a follow-up study on the pilot project that we did many years ago, looking at the effects of retail density now, about 10 years later. People have any questions or thoughts or comments during my presentation, please feel free to interrupt and ask. I don't know if that's the procedure, but I welcome that if that's how the structure for this talk is set up from the organizers. So about 1 billion people are expected to die in about 100 years from tobacco related diseases worldwide. So that's a very huge number. That's as the number of people living in the country of India about now. So that's a huge number, and one of the major strategies that we hope to use to reduce this number over the last 100 years is reduce access to tobacco products for young people, especially to reduce frequent experimentation and initiation of regular use in young people. And then also reducing access helps current users as well in terms of if they want to reduce their use or it may even aid in quit attempts. So reduced access is one of the critical policy and environmental strategies that the tobacco control community uses to reduce tobacco burden in populations. The other is reducing tobacco promotion. There's so many different efforts being done worldwide, including in India, to reduce promotion of tobacco, such as in movies, in film, in TV, in billboards. Over the years, you can see that the environment is changing in terms of promotion as you even walk around urban spaces in India. So promotion and reduction of promotion is a critical prevention and control strategy, and as is reduction of secondhand smoke. I highlight these three kind of areas of tobacco control because these are the areas that our study mainly focuses on. We try to understand environmental issues associated with uptake of tobacco use in young people, and we focus on issues of access, promotion, and exposure to secondhand smoke in our study. So the pilot project we did years ago focused on this issue of access, and we tried to measure tobacco outlets and tobacco advertisements in neighborhoods in Mumbai to understand if they are associated with, or the variability in those things are associated with tobacco use in young people. And we were also interested in issues of compliance. In India and in many other parts of the world, compliance to tobacco control laws, especially in areas like the point of sale or smoke-free spaces, may not be as high as you would like it to be. And so we were interested in issues around compliance and if compliance was associated with tobacco use. And this was a project funded by the Fulbright Nehru Scholar Program, and Dr. Gupta and his team were my hosts during that year of my time in Mumbai back in 2010. So that was really the beginning of the study that we're doing now. And I really thank Dr. Gupta and his team for allowing me to come and take that time with them and work with them to do this project. And another host was Tata Memorial Hospital and Center. Dr. Shastri at that time was there, and they hosted me there while I was doing this project with Dr. Sharmila and Gauri, who work there now still. So we worked with them to accomplish this pilot project. And what we did was we did a high school student survey in Mumbai. We sampled 26 schools and 1,500 students in Mumbai. It was a population-based sample, so we can make some generalizable estimates and conclusions from our study. And we mapped out all vendors and tobacco advertisements in the neighborhoods around the schools we sampled. And we did surveys in about 400 random sample of tobacco retailers in those neighborhoods to understand compliance issues and other issues at the point of sale. And what we learned from that study was that the density of ads and the density of retailers is associated in this sample that we gathered with smoking tobacco, particularly ever trying tobacco and using smokeless tobacco and using any form of tobacco. We couldn't look at smoking because there was not enough smoking tobacco use. So ads were very important at a near space to schools, spaces within 100 meters of schools, whereas retailer density was not as important. So the number of retailers that were present near school neighborhoods. I guess I should explain, these are densities of ads and retailers around schools. And what we're doing is we're measuring the association with high density relative to low density in ads, medium density relative to low density in ads, and so forth, again, with retailers here. And this data shows us there's a significant association between ad density and using tobacco in high school students in Mumbai. And we looked at the 500-meter range as well. And that study, analysis also showed some effects with tobacco use. And in this case, retailer density was associated with current tobacco use in kids, smokeless tobacco use. So we had some information that there is some effect of the concentration of tobacco vendors in neighborhoods and using in kids, at least in this sample. And it was a cross-sectional study, so we can make some very strong conclusions about these results. And we were also interested in the issue of compliance. What was the level of compliance with selling to minors or having the signage there that states that it's illegal to sell to minors, the ad compliance and so forth. So we measured different levels of issues around compliance. And we learned that there was only 3% compliance overall across all the vendors to all the laws around tobacco control at the point of sale. So compliance was quite low, but it was variable. So we were able to actually look at the relationship between compliance and tobacco use in young kids, in adolescents. And we found that community level compliance was associated with current tobacco use and current smokeless tobacco use, meaning this combines smoking and smokeless use, and this is only smokeless product use in the past 30 days. So the higher the level of compliance, the lower the level of the risk of use in this particular sample. So we not only found that the density of tobacco vendors was associated with higher use, we also found that when there was higher compliance, there was lower use. So the tobacco environment, the neighborhood environment, does play some role in the behavior of children around tobacco use, particularly teenagers, adolescents going to high school in India. So we use this data to see, well, can we look at these issues in a more rigorous fashion and collect better data, use a more rigorous study design and so forth to look at these and other environmental issues around tobacco use initiation in kids. And that's where this longitudinal study of adolescent tobacco use comes in. So we took some time, would write up the pilot results over several studies and papers in international journals. And then we applied to the NIH with some firm footing on pilot data for this study. And this study expands the previous pilot work by looking at the environment in a more, I guess, holistic fashion. We're not just interested here in looking at the compliance issue of the point of sale, but we're also interested in compliance issue around smoke-free laws in public spaces. And we're also interested in the issue of vendor density in this study as well. And we would also like to look at longitudinal changes in these environmental factors to see if those are associated with tobacco use in adolescence and tobacco use initiation. The other thing that we're looking at is the issue of context of the family and how the family might, either transmit some of the risks that are in the environment or protect individual adolescents or kids from some of those environmental risks, like high density of tobacco products in the community. So this is a study that I'll share some baseline data on right now. And this is the conceptual model that informs the study, just to give you an idea of the kind of hypotheses that we're trying to test in this particular study. So the main hypothesis here is the relationship between the community tobacco environment in adolescent tobacco use, particularly initiation of experimental use, initiation of regular use, and the intention to use in the future, particularly of the younger adolescents. And the environmental factors we're especially interested in are issues of density of tobacco vendors and ads, and also adherence or compliance with laws around sales, advertising, and smoke-free laws. And this is the mechanism that we will be testing in our study, looking at whether this environmental factors are really working through the process of access and affecting tobacco risk in kids, use risk in kids, and the role of family factors in moderating these relationships. So that's the basic model we're going to be exploring. And this is the design. We're using a population-based longitudinal cohort design here. And we've sampled 12 to 14-year-old adolescents in 52 neighborhoods in Mumbai and Kolkata to make up our wave one or baseline sample. And we're following these children or these kids annually over 4 waves. And we're right now just completed wave 2, and we should be starting wave 3 in the next week or 2, actually. And parents and the adolescents complete a survey, a questionnaire about tobacco use and intention and other factors, a host of other factors. We also map out their neighborhoods in terms of the retail environment, the smoke-free environment, and as well as the compliance environment. We do random checks of points of sale and also public spaces. And we plan to do random circuit shopper visits to see if we can do some compliance with sale to minors, which we were not able to do very rigorously in our baseline data or our pilot data. So this is a geographic coverage of our study. This is the left is Mumbai. Of course, I've not labeled any roads or anything to keep things a little bit more anonymous or here. But this maps show that we have very good geographic coverage for our sample. We worked really hard to develop a population-based sample that's representative of these 2 cities. And I think in terms of geographically, we've done a pretty okay job in terms of dispersal. And these are the baseline data in terms of our demographic results. And in terms of demographics, we didn't find really any difference between Mumbai and Kolkata. The first 3 sets of bars here are the age groups. We are recruiting 12, 13, and 14-year-olds at wave 1. And you can see most about, a third of are in each group. Maybe there's an oversampling here of 12 and 13-year-olds. Male-female proportions seem to be equal. Maybe there are some more females than males in Kolkata. In terms of religion, we have mostly Muslims and Hindus in our sample. And our samples tends to be relatively low income, I would say. About 90% of the sample earns less than 40,000 rupees a month. Let's see, and this is the tobacco use data and psychosocial risk factors at baseline. We see that there's very little tobacco use behavior in this sample. Because there are 12 to 14 years, they're a young adolescent group, so we expected these numbers to be quite low in the baseline data. The idea for the study is to look at the trajectory of these behaviors and to see if these trajectories are associated with the environmental factors that we've been talking about so far. We did find that there's substantial intention to use. There was some awareness of e-cigarettes. Well, Dr. Gupta, I think, may talk about a little bit later. There was a lot of perceived peer use. So a high endorsement of tobacco use norms in their peer group. So there is some evidence that there's a high level of psychosocial risk for tobacco use, although we didn't see good evidence of behavioral behaviors in these areas. These are household factors related in our study. Just I guess I wanted to say in the previous slide, the only difference we saw between Mumbai and Kolkata was this variable. Some or more peers use tobacco. There was more tobacco use norms in Kolkata than in Mumbai. In terms of the household factors, there was a lot more household environmental risk for tobacco use in kids in Kolkata than in Mumbai. As you see here, there was more weekly exposure to secondhand smoke in the home and outside the home. About 90% of adolescents reported weekly exposure to secondhand smoke outside the home in Kolkata versus a third in Mumbai. So there's a huge difference and a huge problem, it appears, in Kolkata. In terms of parent use, about 44% of father figures in Kolkata use tobacco, while 33% in Mumbai. And there's more tobacco use allowed in the home in Kolkata than Mumbai. And it seems like kids in Mumbai tend to report that it's easier to talk to their parents about tobacco use than it is for adolescents living in Kolkata. So this kind of indicates to me that there might be a higher risk of tobacco use in adolescents living in Kolkata, but we'll see as the study moves forward. And these are factors related to school and community in terms of tobacco environmental factors. We see that, again, maybe Mumbai is a little less of a riskier environment than Kolkata in these terms. We see that there's more tobacco use education in Mumbai than Kolkata, and there's more schools in Mumbai that report, or more adolescents in Mumbai that report that their school has a no tobacco policy. In terms of ads, about 16% of kids in Mumbai reported seeing ads sometimes or often near their homes, and 44% reported endorsed this response or these responses to this question in Kolkata. So much more environmental risk in terms of ads and promotion in Kolkata than Mumbai. So in terms of just conclusions about this first set of slides and data, I guess what we're trying to communicate is we've established a pretty good cohort of young adolescents in India to study the issue of tobacco use initiation. And this cohort seems to be appropriate for this type of study because they have not initiated tobacco use yet. And we plan to follow them up for a couple of more years to see if the initiation process occurs. So I think it will be an ideal data set to understand this problem. Because our sample was so young, of course, the tobacco use rates were quite low. We did find that Kolkata adolescents tend to report more peer use, more exposure to secondhand smoke, more presence of ads in their neighborhoods, and putting them at maybe greater risk of future tobacco use than kids in Mumbai. We plan to use these data and of course combine them with the follow-up data to understand longitudinal relationships between some of these multi-level factors, such as the environmental factors that we're collecting data on. So this is a segue into the second half of the talk, which is the environmental information that we're collecting. So this analysis that I'm going to report on now has to do with the issue of neighborhood density of tobacco retailers and psychosocial risk of tobacco use in the sample during wave one. Giri, who will be talking next, will be talking a bit about compliance information related to point of sale and smoke-free environments. So we're going to spend a little more time during the next, I guess, hour or so looking at these environmental data. So with this analysis, I guess our idea here was to build upon our pilot work and the research that already exists in other parts of the world, and some research in India that suggests that the reduction of the retail outlet environment around tobacco may be an important way to reduce tobacco use in young kids. The objectives of our study was to look at intention to use, ease of access to tobacco products, and perceived norms around tobacco use as outcomes, and whether to see if tobacco retail outlet density was associated with the psychological outcomes rather than behavioral outcomes, because as I just said a few minutes ago, we had very few adolescents in our sample that said they used any form of tobacco. So in terms of measures, yes.
Ritesh, to be fair to everybody else, could you shorten your further talk a little bit? Thank you very much. Very comprehensive introduction.
Oh, I will do that. Or maybe give me maybe 3 more minutes and I'll wrap it up. I think it should be enough time. I apologize for running a little longer. So in terms of measures, as I said, we measured intention to use, ease of access, tobacco use norms, and density of tobacco products outlets. So these are some images of the maps that we have been working with in our study, and these maps represent maybe high, middle, and low density areas in terms of tobacco retailers. The yellow dots here represent tobacco retailers, and this area here is the neighborhood. So we've mapped about 5,041 tobacco retail outlets across the 52 neighborhoods, on average 97 outlets per neighborhood. And we did find that there were more outlets in Kolkata on average per neighborhood than Mumbai. 105 in Mumbai versus 90 in Kolkata. So this is our exposure variable that we are analyzing in terms of effects on risk of tobacco use. I won't go over this slide because you've kind of already seen the distribution in terms of demographics of our sample. But in terms of the effect of this variable, a number of tobacco vendors or retailers in the neighborhoods, and these 3 outcomes, intention, ease of access, and peer use, we did find when we divided the density measure in tertiles that there was a relationship with ease of access, that kids in neighborhoods that had a higher density of tobacco retailers were more likely to say that tobacco was easier to access for them. But they didn't report higher intention to use or higher norms around use for tobacco. There are some other demographic differences, but because of time, I won't go through that very much here. So the implications are that reducing tobacco outlet density may be an important strategy to consider to reduce tobacco use risk. In this specific study, we only saw that there was an ease of access effect, not intention or normative effect around tobacco use. But other studies and our pilot data also suggest that reduction of the density might be useful. And in Indian context, I think many of you know, just walking around in many of these urban areas, tobacco is so readily available, it might be important to figure out strategies to make them less accessible. So I think that's the major implications of that second study. I just want to say thank you very much, and thank you for allowing me and our team at Helix and also at UCLA to come share some of our research with you. I'm happy to discuss this work with folks at any time, so please feel free to contact me if you wish to. And we're happy for folks to collaborate in the writing of any research from the data that we're collecting. So collaborations in that way are welcome. So I thank you all, and I'll turn it over to Dr. Gupta again.
Thank you very much, Ritesh, for that very comprehensive introduction. I'm sorry I had to interrupt, but okay. I think you did a fantastic job of giving the background, introducing, and a very, very generous, I would say, invitation to all researchers attending this session for collaboration. So thank you very much.